My name's Sanjay Gupta. I'm a cardiologist in York. This is my partner in crime, Bluebell Gupta. We together run York Cardiology, and today we just had a board meeting, and then I thought I would do a quick video. So today's video is on the subject of evidence-based medicine. This video is entitled "The Problem with Evidence-Based Medicine." So we're told that medicine must be evidence-based. And in principle, that's absolutely right. We want treatments that are tested, reproducible, and safe. But what happens when we become so reliant on evidence, so afraid to step beyond it, that we stop thinking altogether? So today I want to talk about the unspoken downside of being slavishly adherent to evidence-based medicine. There is a phrase I hear a lot: there is no evidence for that. And it's often said as if that settles the matter. But here's the issue. If we refuse to do anything unless there's evidence for it, and yet we never allow ourselves the freedom to explore or experiment, how will new evidence ever emerge? How do you build an evidence base without first building experience? Courage precedes data. It always has. Even when we do have evidence, it is not always as solid or as universal as we think. Much of it comes from pre-selected controlled populations. Clinical trials exclude people with comorbidities. They rarely study the elderly, the chronically complex, or the subtle outliers. But those are the people we see in clinics every day. So what we're doing more often than not is extrapolating, not applying. Experience is often treated as inferior to data, but without the bravery of clinicians who tried things carefully, compassionately, and creatively, there would be no data to begin with. Most of medicine is still practiced in the grey, in the spaces where data runs thin and human judgment has to fill the gaps. Experience gives rise to observation. Observation leads to hypothesis. Hypothesis leads to trials, and trials lead to evidence. But if we silence experience, the whole chain breaks down. So evidence-based medicine should be a guide, not a gag order. It should inform decisions, not replace thinking. It should support clinical intuition, not suffocate it. And when we turn evidence into dogma, we lose the very spirit of medicine: to explore, to understand, to adapt, to treat not just populations, but people. So I'm not anti-evidence, I'm anti-fear. Fear of criticism, fear of being different, fear of stepping outside a guideline to do what feels right. What medicine needs now is courage. Courage to say, there is no evidence yet, but I've seen this help. Courage to trust what we see, not just what we are told. And courage to remember that the evidence base of the future depends on the questions we are brave enough to ask today. Video's done. We can go back. We can go continue our board meeting. All the best. Take care. Bye.